Hello everyone, welcome to Ask the Aesthetic Mentor, wearing the official logo. I just realized whether you do it as a selfie or whether someone's taking the photo, that is exactly the same, backwards and forwards, so it works. I'm very excited to be with you tonight. Hello Dr. Lynn, a regular on our program. We're getting our usual posse of folks coming in. Good to see you all tonight. Happy Tuesday. It must be Tuesday if it's the Aesthetic Mentor and he's having us ask questions. My faves too. I've been watching on Instagram, Dr. Lynn. Looks like you have a very nice family, and I'm glad you found time to take away and visit us. Quincy Spa. So, welcome. I wanted to just make an announcement before we start. My staff was looking. I always say, find out what's trending so we can talk about it. And, stay active and stay cutting edge with respect to what people in the industry are asking about. But they also wanted me to mention that next Wednesday at 7 p.m., that's May 4th, a week from tomorrow, we're having an open house, a virtual open house that we've been working very hard on for a Connecticut school. So the nice thing about Connecticut is that people from all over the country and all over the world. Hello, Christine. My God, it's been a long time. So that anyone in the country or even out of the country can take courses in Connecticut because they're very easy in terms of getting a temporary license. So you can come to Connecticut from any state in the country, treat patients, have a very rich clinical experience, and learn from us, the best. So that's next Monday at 7 p.m. We're always at 7 p.m. for some reason. Just go to the link in our bio and you can sign her up right there. How easy is that? Aesthetic Mentor Connecticut. We've got a cadaver course coming up on next Monday that I'm going to be teaching, and I'm very excited about that. And I'll be there. I like to teach in person as well as having all my online stuff because it really connects me with the students and I get a sense of what they're really interested in learning about. So please join us if you can. So go to the link in our bio. It's the open house in Connecticut a week from tomorrow, May 4th. Sign up right there and we'll see you online. So tonight, my staff came up with the following thing. I mean, it's actually kind of interesting because how many of you recently, within the past, few months, have been seeing patients who are concerned about their appearance, but primarily because they're preparing for a big event, the wedding of a child or someone in their family, and it's a big event and they want to get ready. So they want to reverse 60 years of aging. Hello, injection expert. We all love injection experts, don't we? We all wish we could be injection experts. That's maybe why we're listening. So they come in and they want to, look great for their daughter's wedding, and it's, X number of months away, and what can you do for me? Well, for me, they're often looking for surgery, a facelift, liposuction, tummy, something, because they're wearing, a nice dress that is revealing of them or in some way shows their figure. So they're all interested in that. However, you can't really be fair to a patient and do a facelift a month before their daughter's wedding. I mean, it just isn't right. So part of it is that we have to really educate them. And sometimes people come in for surgery and I'm just like, you know what? It's too risky. It's too close to your daughter's wedding. So we can't do it. We can't do it. But what can we do, right? And when should we start preparing them? So for those of you, hello, Brittany. For those of you who don't do surgery, we have to be prepared, because when patients come in and say, hey, listen, I don't really know much about this stuff, but I know my husband and I are, going to be the father and the mother of the bride, and we want to look our best for the photos. What do you recommend? Well, I mean, obviously we have to go through what you recommend is I wish you were here 3 months earlier, but nevertheless, we're going to deal with this straightforward. Just do your systematic evaluation. Look at them. Do they need neurotoxin, right? It's a big one because you're smiling in their photos, right? You don't want a lot of wrinkles. Do they need filler? Do a full face assessment. Do they need skincare? Of course they do. Everyone needs neurotoxin. Everyone needs fillers. And everyone needs skincare, right? But do we need to go beyond that? Do they need some energy-based treatments to their face and skin? Do they need ultrasound? Do they need laser? Do they need radio frequency, or the latest form of matter, plasma? And we'll have a separate show, I think, on plasma technology, because it's really kind of cool and it's really interesting. I was telling everybody that we are having a virtual open house next Wednesday, not tomorrow, but a week from tomorrow at 7 p.m. For our Connecticut location. So go to the link in our bio, and you can sign up right there. We'd love you to join us. It's going to be really interesting and really fun. And we've been working on it for a long time, so it's probably going to be decent at least. So give us a little credit. But anyway, so when you do your full assessment, look at them. Do they need neurotoxin? Do they need fillers? Do they need energy-based treatments? What kind of skincare products do they need? Do they need microdermabrasion, microneedling? Do they need microneedling with PRP? Whatever it is, and kind of talk to them about it. Just kind of educate them about it. Do they need laser? Do they have? I saw this woman the other day whose entire back and décolleté were like just covered with seborrheic keratoses and all kinds of pigmented lesions and stuff, and it was just too much to go after them one by one. So I got rid of the big ones and I sent them upstairs to the med spa to do some peels or laser treatments or something to help her, because it was just too big an area, and we were trying to fight time because the wedding's coming up. And she was wearing a dress, of course, that was like this in the front and like that in the back, so all these areas were exposed. So she just wanted to look her best, and I understand that. So some people need vascular, some people need pigmentation stuff, and some people need tattoo removal, right? Some people, if you order those things, it's really, if you offer those things, it's really important to talk about them. But I think you start at the top and just give them the full deal, right? Just be very honest with them. In this business, honesty is what it's all about. And I don't mean honesty in terms of like being mean to people, but just, say, listen, let's just be honest about this. We're not going to really reverse 60 years or so of aging in 1 month before a wedding. It's just not fair to you. It's just not possible. And I'm always honest, Kate. Thanks. And I think you are too. And I appreciate you being a loyal viewer of this show. In Mode Austin, he's kind of been not coming around so much lately, but now he's back. Well, he's back. Good to see you. Saitan, thank you. Red stuff, brown stuff, fine lines and wrinkles. That's what it's all about. That's what Saitan in New England's all about, treating all those things. So I think to answer the question, when do people come in? Because not only are they interested in face, but listen, they're wearing a dress, they're wearing tight clothing, they're wearing stuff that's kind of revealing. So body is big, and I think in this industry, particularly, the facial aesthetics field, people focus so much on the face. Everyone's doing neurotoxin, everyone's doing fillers, everyone's doing energy-based treatments, but the body is being severely neglected, and there's a huge opportunity zone there for all of us. So they might need cool sculpting, they might need Kybella, they might need some heat-based treatments to kill the fat, because it's really about fat. It's really about tightening, maybe some RF microneedling, that sort of stuff. So kind of go over the whole thing and be honest with them, and let's try to get. Based upon their time frame, if if their daughter's getting married a month from now, you have very limited ability to offer them a whole bunch. You can do neurotoxins, you can do fillers, but what if you do a neurotoxin dose and it's way too much and you give them a ptosis? Is that something you want to have your name on? It's happened to me. Even fillers, suppose you have a hematoma, suppose you have an occlusion, suppose you have something terrible happen. It's really risky to do any of these things just shortly before a wedding. So certainly skincare products, certainly some energy-based treatments to the face, all these kinds of things are helpful, but it's almost too late. It's almost like you're putting a Band-Aid on a bleeding wound. So encourage your patients to start earlier. I think 6 to 12 months, I'm being totally serious with you, is a time when you got to start. Because even think about it just from the point of view of neurotoxins, right? You want to go through several cycles of neurotoxins, because if they've never had neurotoxin before and you've never treated them before, we're playing the guessing game. We don't know exactly how many units to give them. We don't know how they're going to react. We don't know how they're going to like it. So we want to go through at least a couple cycles of neurotoxin to be sure that they are going to like the results. So when they smile for the wedding photo, it looks pretty good, right? and the father and the wife might have different desires in terms of how many wrinkles they want to have showing during the photo, etc. And then fillers the same way, right? I mean, if we're going to do fillers, we want to start slowly and gradually. We don't want to freak people out and change the way they look. So, these, if you treat someone, you got to wait at least a month or so before retreating them, in my opinion. So you probably need several cycles of fillers. And again, you got to start slowly and do a few at a time. You don't want to do 10 syringes of fillers to someone who's never had it before, a month before their daughter's wedding. I mean, it's just cruel and unkind. So you have to think about that. And then if people are going to need cool sculpting, right? If they're going to need some sort of fat reduction procedure, you've got to plan that out several months in advance too. And if these things are happening simultaneously, if you're doing facial injections with neurotoxin fillers, if you're doing diamond gloves, if you're doing skincare treatments, these all take time. If you're doing dermaplaning to help this stuff penetrate, if you're doing energy-based treatments like Softwave or Ulthera, or radio frequency treatments or microneedling, I mean, it takes more than one treatment. So, I'm thinking a 6 to 12 month cycle is what is really needed for the patients to look the best. Now, not everyone's going to give you that opportunity. Fortunately, the patients we've been seeing recently have sort of recognized that and realized that you can only do so much within a certain period of time. Plus, almost all these patients have budget constraints because they're spending all this money on the wedding and everything around the wedding. So, but also they want to look good themselves, and so they want to feel better, look better. So it's an interesting time. So maybe, if you want to, it wouldn't be a bad idea to send out, an email blast to your patients and say, hey, it's, not only is it a wedding season, but it's like, it's Holy Communion season, it's Bar Mitzvah and Bat Mitzvah time, it's party time, it's people retiring time, it's everything time, right? So people have lots of things they're doing, and so they always have a reason to look better. So if you get ahead of that, send out an e-blast saying, hey, it's that time of year where everyone wants to look best for their events, so plan at least 6 months in advance to come in and get buffed. And then you can have sort of a list of the services that you want, and you can sort of say these are the most important ones that you need to know if you're interested in body, if you're interested in face, if you're interested in neurotoxins, etc. A lot of people don't speak the truth like you do, but we appreciate it. Listen, I don't know any other way to do it. You have to. I mean, education is truth and truth is education. It's sort of like, I have made a lot of mistakes in my 31 years of practicing, and I don't want you guys to make the same ones. I want you to avoid it so that you and your patients have great outcomes, so that the industry in general has great outcomes. Because the minute we don't have great outcomes, the minute we start having problems and complications and things get reported to these various boards, it's trouble. It's trouble, and we may lose things and never get them back. So I appreciate you saying that, and I do speak the truth, and it's not always pretty, but it's honest. And that's why when patients come in, you have to be honest with them, because the last thing you want is a disappointed patient. The last thing you want is a patient says, you told me this and that didn't happen, and blah, 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 blah. That is a bad way to end a relationship and a bad way to have your name out there. So sometimes the best thing to do is say, you know what, it's too close to the wedding. I can't do surgery. I can't do filler or neurotoxin. God forbid you should have a complication. I had a patient that I had injected with neurotoxin and fillers for like 7 or 10 times before, and she comes in like a month before her son's wedding. Her son was a doctor, and he was marrying a doctor in a very big wedding at some very big hotel in New York City, very fancy and stuff. And wouldn't you know it? Wouldn't you know, the one time, the 8th time that I injected her, she got a ptosis, a pretty severe eyelid ptosis of one eye. And you might say, well, why did that happen? And I'll say, I wish I knew, because I wouldn't have done it. But I don't think I did anything differently the 7th time compared to the 8th time. I don't think that I made a different dose, but she's also somebody that plays tennis a lot. And I always told her, don't play tennis for a day after. Don't wear your visor. Don't bend over. Maybe after the 7th time, she said, oh, Russo's full of it. He doesn't know what he's talking. I'm just going to go do. Once they leave your office, you don't really know what they're going to do. Did they massage it? Did they have an itch? Did they wear their visor? Did they I don't know. Who knows? I can make up a million reasons. But the bottom line is, I don't know, and it doesn't really matter. But I probably shouldn't have treated her a month before her son's wedding. So what did I do? Hello, Charles and Maverick. Hello, Gail Driscoll. It has been a while since Gail was a guest on our show. Then she stopped watching us, and I don't know why. Just kidding, Gail. Good to have you aboard. So what did I do? So I prescribed some. Actually, her husband was a dentist, and he prescribed some iopidine or some drops. And guess what happened to her? She was allergic to the drops. Of course, she's a dentist or doctor's wife, so that's kind of predictable. So it got much worse. Not only did she have ptosis, but she had an allergic reaction in the eye where she had the ptosis. So now we're at the 3-week point before the wedding. And it wasn't pretty. And I was just so apologetic and stuff, but what could I do? So I saw her. We found some other drops that were helpful to her. I wasn't at the point then when I was actually injecting the orbicularis oculi muscle to treat the ptosis. I just wasn't at that level, but I am now. So we gave her the drops. We said, put like a bunch of drops. Yeah, Brittany says, oh my God, an actual nightmare. Yeah, I'm telling you these nightmares so you don't have the same nightmares. I'm not sleeping at night just to protect you. So I told her, so when you take your photographs, do this side because this is your good side. Don't do the bad side. I have a little sty, so it kind of looks like I have ptosis, but I don't. So as it turned out, she did a lot of the drops just before the photo, and she had, a reasonably good open eye. But if you look closely, you could see. And, I learned my lesson, right? So when she came back, I was just so apologetic. And the next time I treated her, I did some filler, did some neurotoxin. I just said, this one's on me. She said, well, you don't have to do it. I said, I know I don't have to do it, but you've been such a good sport. You came back to me. I'm really sorry that happened, and maybe all's well that ends well, but I shouldn't have done it. I shouldn't have injected her. I should have said, you know what? It's too close to the wedding. God forbid you should have a ptosis. Have a little bit of wrinkling. Don't worry about it. It's better than a ptosis, right? But that's kind of one of those lessons you learn the hard way. And I've seen that from a couple of other patients who've come to me from other injectors who've had the same thing happen to them. And it's always, listen, we're in the business of helping people, right? We're here to help people. So when someone comes in and asks for your help, you try to help them. But you have to temper that with the reality of what would happen if things go wrong, right? We don't always think about that, but when someone is coming to you and saying, when should I start doing these things for my wedding? Give yourself a long runway, right? Give yourself a really long runway. Do several cycles of neurotoxin, do several cycles of filler, start working up on the energy-based treatments if they need cool sculpting. So these things take time. You don't ever want to be rushed or pressured into treating somebody and doing something faster or at a pace that you're not comfortable with, because as an injector, you have to be completely comfortable in your own skin, completely comfortable with what's happening with the patient. And if you're not, honestly, don't do it. You can say, it's easy for him to say that. He's better. It's not easy for me to say that. I send people away that want surgery because I just don't feel like they're appropriate or that we're going to have an appropriate and reasonable interaction. And I feel sometimes that people are maybe not ever going to be made happy. And these little voices inside your head or wherever they are, or that feeling in your stomach when you start to get that knot, are actually real visceral feelings that are reacting to something that's happened in the past. And when these certain patients come in now, I sort of get my antenna up and say, I don't know that I want to treat this patient, and my staff almost always agrees. So part of it is just not only being honest, but being, sometimes helping the patient. The best thing to do to help the patient is to leave them alone, right? Sometimes you don't want to open up Pandora's box. So back to the questions. How early do you start treating people, and what do you start with? I start as early as possible, right? Give me at least 6 months if it's something, significant. If you're 60 years old and you haven't really done anything before, I want 6 to 12 months, okay? What do you start with? I start with a full evaluation. I start with, okay, you've got wrinkles on your forehead, you've got wrinkles around your eyes, you've got wrinkles in the middle, your glabella, your skin looks ruddy, you've got broken capillaries, you've got hyperpigmentation, you've got volume loss in your cheeks, you've got volume loss in your lips, you've got volume loss in your temples, you've got volume loss, kind of going on and on. I treated a new Botox bride 2 weeks ago to start getting ready for her October wedding. I told her you're starting Yeah, this is good. This is absolutely the right thing to do. And she's smart and you're smart as well. And now's the time to find out what the right dose is and to find out where to inject the volume and all that sort of stuff, because you don't want to find out that you made a mistake a week before the wedding. For lips only, how much would you recommend? Lips are a little different, right? Because lips last a long time, but I think I would just do a conservative treatment on the lip, because it also depends on what you're doing, right? So if you're treating someone's face and if you're making their mid-face bigger, if you're making their perioral area fuller, if you're treating marionette lines or whatever it is, in effect, you're making the lips smaller, right? So you can say to them, by the way, as we treat these other parts of your face and expand them, your lips are going to look smaller. So we might want to treat your lips once we're done with all this other stuff. And with lips, once you fill them, depending upon what filler you use, it usually lasts a long time. I'd love to get 2 cycles out of it, but even one is good, or one, a conservative one, and then maybe a touch-up later is fine. But I would kind of do that at the end once you've seen how the rest of the face fills out, because you don't want the bride to lead with her lips, right? You don't want all the photos to go, like, what's going on with that girl's lips? Like, she was a beautiful bride, but now all I see are her lips. You don't want that. You don't want that. So start conservatively, particularly someone who doesn't have big lips. They always seem to think you've overdone it initially, so don't be surprised if they're back a couple weeks later for more. But so back to the question, what do I start with? So do your full evaluation, right? And everyone's going to need neurotoxin. Everyone's going to need fillers. Everyone's going to need skincare. Everyone's got hyperpigmentation and broken capillaries. I mean, again, these are the parents of the bride, or even the bride herself. Everyone's going to have, so you got to start with some skincare products. Have them buy in on that. You got to start with some treatments, whether you do Diamond Glow or hydrofacials or any kind of resurfacing. You got to start with, microneedling with RF. Austin would like me to say Morpheus, but there are other options out there as well. But you know what I mean. And then start with the neurotoxins and fillers and explain that you have to cycle it and find out the right dose and get the right amount, and you can only do so much filler at one time. So start with those things, because those are all really good. And if you can't do anything else, that's fine too. If they also want some body stuff, if they want some body sculpting, you've got Sculpture or True Sculpt or Cool Sculpting, or even Cool Tone, right? To give them RM Sculpt or any of those things. Those are cycles, right? So those take a few months to really get to your end result. So say, listen, we need to start now. We need to really get going. So I think you start with those things. Like, you have to look at where the problem is, and you say to them, like, these are all the things I see. What bothers you? Because you're going to be taking the photos. Do you want me to get rid of these lines? Do you want me to give you some fuller cheeks? And you, as an injector, as an expert, are there to educate them. Right? You are there to tell them what is really going to make them look right. If they say, listen, I've got a budget. I've only got, make up a number between $1,000 and $8,000, whatever it is. Be judicious with it. Give them the biggest bang for their buck. What are the procedures that are going to give them the most improvement, and with the least amount of money? I think everybody's going to have to include the three, neurotoxin fillers, and some kind of skincare treatments and some kind of energy-based treatments. I think the upper, like from here up, you can pretty much handle almost everybody. Neurotoxin fillers, skincare. Here down, not so much. Here down, you're talking about more aggressive treatments. Almost certainly some energy-based treatments, radio frequency, ultrasound, laser, plasma, something. You're talking about more volume. You're talking about just more problems, right? And bigger treatments. I'm potentially talking about some surgical treatments for them, etc. How long before? Oh, the question was, how long before the wedding should you stop treating them? At least a few weeks, if not a month, because if they do have a complication or a problem, you want to be able to make it look better. By now, I had one patient in particular, Brittany. If you thought that was a nightmare, listen to this one. Patient came in not to see me, but to see a nurse. No value judgment, just fact. And it was the patient's first time she was being treated. She was how long for a Kybella? Give yourself at least 6 weeks on that one, particularly if they swell a lot. At least even for the first round, you're probably going to need more than one round. So she goes to this nurse, and her son's getting married in California at a big wedding, fancy, marrying someone very wealthy, etc. And she goes to her and gets treated. Very first time was treating her lips. And she had a terrible occlusion. The nurse who was treating her acted like nothing was wrong and told her to go home. I mean, it turned white. The whole part of her lip blanched and turned white. She told she told the patient, just go home, take some aspirin and massage and some pain and take some Motrin, and it should be okay. It wasn't okay. Came back the next day, didn't sleep at all that night. She was a lawyer, worked for the FBI. Her husband was an emergency room doctor in the town we work in, and was on call that night, so he wasn't home and didn't see her. So she struggled the whole night, not sleeping, in terrible pain. Her lip was as white could be. She came in, so the nurse finally said, I'm going to send you to Russo. So she comes in, and her lip was just like, it was like a piece of wood. We immediately started some hyaluronic. Brittany's asking me to stop, please stop. It was heartbreaking. It was heartbreaking because, well, as you know, after going through this with this patient for a while, 2 PRP injections every day, massive amounts of hyaluronidase, skincare products galore, we offered her hyperbaric oxygen therapy, whatever. She ended up with this pretty big area of necrosis. I don't know. Here. And now her lip didn't completely fall off, but a good part of it died. I took care of this patient that I didn't treat for 2 years. Never charged her a cent. The nurse that treated her never came with her, even once, to see her, to help her, to give her a ride, anything. Just dropped out, like, see ya, I'm gone. So after 2 years and several surgeries and all this sort of stuff, she was pretty good. She still couldn't really keep a lot of liquid in her mouth at any one time, etc. But we did a lot of work. But back up to the wedding. So we're now about 2 weeks before the wedding, and the patient comes in one day and just breaks down crying. And I was like, I'm starting to get a little choked up. She starts crying, and I was like, you've been doing so great. Like, things are healing well. Like, we're going to get you through this. Like, what's the matter? She's like, I got the wedding in 2 weeks, and I have this big black scar on my face. I said, you do. But we're going to help. So I debrided the scar. I put some growth factor on there. I PRP'd the heck out of her. She went to hyperbaric oxygen therapy. And a few days before so she was going to fly out to California for the wedding. And a few days before the wedding, it had reepithelialized and kind of was a closed wound now, and was better. When she flew out there to California, the bride's family, because her son was the groom, the bride's family had a professional makeup team waiting for her. And they professionally made her up And she turned, her bad side away from the camera when they did the photos. And it was okay. It was okay. It was okay because she was able to be in the photographs and, be a part of the wedding and enjoy her life for a little bit and get away from this crazy stuff that was happening to her face. And as I said, it was about 2 years of my time and my effort and my energy. I'm not looking, I'm just telling you this, like these things can be really bad. And she ended up okay. Like if you saw her and like never met her before, you wouldn't necessarily think anything was wrong, because a lot of people have funny ways that their mouths work. Like there's always some asymmetries in the mouth. But the real point of this story was, the patient came in a month or so before her son's wedding and wanted to have everything done, and her son picked a winner. She had a full glam waiting for her. Yeah, her son picked a winner. But that's our problem as providers, because we want to help everybody. We want to think we can help everybody, and we want to try to help everybody. But sometimes we shouldn't, right? Sometimes we got to say, it's too risky, and I don't want to risk ruining your wedding day or whatever day for that. So, lesson: send a letter out to all of your patients. E-blast. Oh, by the way, Brittany, I've been asked to announce it next Wednesday, a week from tomorrow, May 4th, at 7 p.m. We're having our virtual open house for a Connecticut location. You can go to the link in our bio and you can register right here, right now online. And the nice thing about Connecticut is you can come from any state in the country and get a temporary license in Connecticut. And I think it lasts for like 3 months or something, and you can do all your training with us if you want and all that stuff. But this is an open house just to explain what she does. Yeah, so in our time, Brittany, you're right. We've probably had, close to 60 occlusions. We've had a few, like 3 or 4 in the last month or something. And all of them, except the one I just told you about, and another one that was very similar to that, were the only 2 that resulted in permanent tissue loss, permanent deformity, and required like 2 years of my time in each case, multiple surgeries. I was just throwing everything I had at these patients to try to make them okay. Now, the craziest part about it is neither patient sued the nurses. And the patient I told you about said to me, if I had come to you earlier, right when this happened, do you think all this could have been avoided? What would you say? Knowing what you know, and a patient who's a lawyer, whose husband's a doctor, who's works for the FBI, who's a brilliant woman, what would you say when she asks you, if I had come to you early, doctor, could all of this been avoided? Because it seems like when you injected me, things got better. I said, yes. Yes. I said, no, I probably said this. I probably said, listen, I wasn't there when it happened. I don't know exactly, but I can just tell you, the sooner you treat this kind of problem, the better the outcome. Right. So you do have to tell the truth. So I said, I can't give you 100% certainty on that, but I would have liked to have seen you sooner. So then she said to me, Dr. Russo, that nurse's confidence exceeded her competence. And I've never forgotten that line. And I said, you're right, and I'm really sorry that this happened to you, but we're going to do everything we can to make it better. What else can you say? Right? So I'm not throwing anyone under the bus, but it's part, I'm not going to lie to this woman. I'm not going to mislead her. I'm trying to help her, right? So I'm just, being honest. I'm not also trying to throw anyone under the bus, although I really wanted to, because I think that what that nurse did was just like the motive of what a serial killer does. Like they hurt somebody and then just move on, like nothing ever happened. Like it was beyond me. The other case I was telling you about where there was a permanent injury, the nurse didn't realize that she'd done something wrong, that there was a problem. And cleaning up after the elephants, yeah, big time. Need a big shovel for that one. She treated here's another one. Treated a patient on a Friday afternoon. The patient had an occlusion and all this bad stuff happening. The patient didn't call the provider until Monday because she didn't want to bother the provider. And she thought this was normal because she never had an injection either. She thought it was normal to have a black area on your face that was painful, and it was just like a bruise or something. And, I saw her 3 days later, and, also, bad outcome. So what we ask all of it's egregious to tell patients to take out, no, exactly. She knew what was going on. She didn't have the ability to accept the fact she'd done something wrong. She was a serial killer, someone who has no conscience. So if any of you who are on this, who are listening to me now, I know you're not like that because you're listening to me now. You're taking time out of your busy days and your busy lives, and you're listening. This person wouldn't, because her confidence exceeded her competence. That's Dr. Russo's middle name, Tracy. He has often helped and clean up the mess for those who can't handle it. They sent it to me because I've seen all the problems, I've seen all the disasters, and I know what to do. But she didn't know what to do, but didn't care and just wanted to run away as far as possible. And later on, when she found out that this terrible thing had happened, she denied it. She goes, Russo's making that up. And I said, really? Let me just send you the pictures of this woman's dead tissue, and you tell me if I'm making it up. I'm serious. She didn't even want to acknowledge that she'd hurt this patient. It was the most pathologic thing I'd ever seen. Juxtaposed that to this other nurse where she had a bad injection on Friday, didn't recognize it. Patient sat over the weekend, came in on Monday. That nurse took the patient to every single appointment for over a year, drove her, picked her up, dropped her off at home, bought her, paid for all of her treatments, bought her food, to the point where a year and a half later I said, you got to stop. This patient's using you now. She's, I'm treating her for free. You're paying me to treat her. She's getting all this stuff. She would give her treatments for free, give her family treatments for free. I'm like, you are being taken advantage of. You've got to stop. And I finally said to the patient, I said, listen, I've done a lot to help you, and I'm happy to help you, but you got to stop because you're abusing that nurse. She does nothing but care about you, and she's trying to help you, but you are taking advantage of her. If you don't stop, I'm going to stop treating you. That's it. And it was just an awful combination of things that have happened. But the point is, if you're going to treat a patient, you should call them that night. You should call them that night and just check on them. It really goes a long way toward creating a great relationship with the patient, and it also is a great way of picking up problems early if there's going to be one. And if the patient has any question, because honestly patients don't know, and the patient has any question or concern, you just say, just text me a photo. The photos always look worse than the reality, I can tell you that. And if you're not sure, so you know what, I need to see you. I'm sorry, I know it's 7:30 at night, but I don't know. I don't want this to wait till the morning, and hopefully it's nothing, but if it is something, I want to be able to treat you right away. You'll sleep better that night, believe me, and you'll learn a lot. But also you'll tell your patients what to worry about, what not to worry about, when to call you, when not to call you. And when you talk to the patient, they say, yeah, everything looks great, no pain, no swelling, you did a great job. That's a great feeling. But also it shows them, hey, he or she cares about me. They really are concerned about me. So I feel comfortable putting my face in their hands, right? So I didn't mean to kind of get off on that whole thing, but the point is that when people are coming in with a big important event, get as much time, get as ahead of that as far as you can, start your treatments early, spend a lot of time educating them. If they have a budget, which pretty much everybody does, would you call a second time after that initial 24-hour call? Only if you had a concern. I'd say everything sounds great. It sounds like everything's super. If you have any questions at all, if you have any concerns, don't hesitate to call me. Or if you're like 10%, 15% concerned, You might say, it looks okay. It's a little bruising. It's it's a little bit red. I'm not that concerned about it, but I'm not 100,000% sure. Why don't you just send me another photo in the morning and let's just connect then? I've done that plenty of times too. Or it looks fine. I'm glad you're not having any pain. But if you have any pain, if it gets any redder, if there's anything happening other than it getting better, just call me right away, and we'll take a look. So you can give them some parameters, Tracy, as to when they should call you. But if you are asking that question, like if there's something in your brain telling you, I wonder if I should call that patient again, it means you should, right? If that little voice in the back of your head is saying, I wonder if I should call that patient again, you've already just answered the question. You should. Because something is telling you, so those little hairs on the back of your neck are getting raised up for a reason, right? We've seen this before, or I'm just nervous about it, or I don't, sometimes you think it looks fine and it's not. Sometimes you think it looks terrible and it's not, right? You just don't know. And sometimes, as I said, it's hard over the phone to be 100% sure what's happening with a photo. So if that's what your conscience is telling you, do it. Do it. You're not going to be bothering the patient. They love it. They're just lying around watching TV or taking it easy anyway, hopefully. So listen to that inner voice. Brittany, do you want to come in for anything? Because I know you mentioned you might want to join, but if you do, just request. Otherwise, if you guys have any other questions, please feel free. I've kind of said all I want to say. Get ahead of it, get early, come up with a treatment plan and prioritize it. Say, okay, I know weddings are stressful. I know they're expensive. I know people don't have a big budget, but just give me an idea of roughly what kind of budget we're working with here, and then you prioritize things. So you've got $5,000, you've got $6,000, you've got an unlimited budget, you've got $150, whatever it is. You're welcome, Tracy. It's my pleasure. I covered everything. I'm sure there's a lot more. Say, okay, so if you've got X number of dollars, these are the things we're going to do for you. These will give you the biggest bang for your buck. And if you have some extra or, whatever, you hit the lottery, these are the other things we can do. But to look good for the photos, these are the things we're going to do. And this is the order in which you should do them. And this is the time frame in which you should do them. And if you can't do it, that's okay. But let's do our best to get this done for you because I want those pictures to look great. I want, this is something that's going to be forever. And I want to help you as much as I can. So, lay it out for them because they need that kind of structure. They need that kind of strategy. And you're the only one who can deliver it to them because you know how to do it. You know what the time frame is. You know your strengths and your weaknesses. Be honest. Be safe. Don't worry about the money. The money's always going to be there. Just be good at what you do. Take care of patients. And if you're ever concerned, always think to yourself, what's the best thing to do for the patient? If this were my mother, my father, or if this were me, what would I want to be done to me or to my mother or my father? And that's all you really need to know. So thank you, everyone. It's been a great night. Don't forget, we're doing a live May 4th, which is a week from tomorrow, 7 o'clock. The link's in our bio. We're going to do a virtual live from our school in Connecticut to teach you guys all about it. So hopefully we'll see you then. Have a good week. Good night.